We're so excited. Day one of the Jack and Sheryl Morris Cancer Center opening for patients. It's already happening. There's a buzz in the air. The only freestanding cancer hospital in New Jersey and one of only 13 in the United States.
Today's a terrific day. This building is emblematic of our $1.5 billion investment in curing cancer. In this building, the only one of its kind in the region, we'll have the scientists on one side, the clinicians on one side, literally bringing advancements in cancer care from the bench to the patient.
For our employees, I think the opening of the Jack and Sheryl Morris Cancer Center really begins a new chapter of how our teams here at the Rutgers Cancer Institute and RWJBarnabas Health are going to make new discoveries, strive to develop new approaches to treating patients, and be able to care for our patients at a level that our skills we're always able to do, but now we have a facility to match those skills.
As I walked in here today, I was able to meet Serena, our first pediatric patient who started chemotherapy at 3 years old. Today she's 5 and she's a princess, and it was amazing to meet her and her family.
She was diagnosed when she was 3 years old with B-cell leukemia, and she's been fighting it for 2 years. It's been an easy fight with her spirit because she's so joyous, as you can see. So Dr. Scott Mulder was one of the doctors that diagnosed her. He made it so warm and caring for us that we chose to be at RWJ.
Another thing that was so special is to see all of the people that work tirelessly every day here. To be able to work in this type of an environment brings a smile to their face. It changes the way they feel, and I believe that when they feel that good, they'll make their patients feel that good. I understand today we'll see upwards of 500 patients as our first day here, and to tour the facility was just amazing.
I hope the patients as they walk in feel that home, family feel. They're not going into a cancer hospital, they're going into a facility that can care for all their needs, both the patient's needs and the family's need. And they become part of the RWJUH family.
We started way back when designing the building from scratch on paper, and I had a series of meetings. So today is the culmination of all that hard work, and I couldn't be more proud.
If I were to describe the new building, I'd say it's uplifting and beautiful. It doesn't feel like you're walking into a cancer institute. You don't really notice it until you walk over here and you realize, wow, it looks like I'm walking into a hotel.
So the spaces that we've had before were very clinical, and this space is much more pediatric friendly.
This whole environment, if you walk through, it brings a smile to your face. So it'll just enhance your experience, I think.
We have toured and seen many of the centers across the United States, the very finest of centers. Humbly, I think that there's nothing quite like this in the United States, and so the entire team has been working for years, really preparing for today's opening, and so it's extraordinarily exciting.
For us as providers to be able to work in an environment like this, to offer multidisciplinary care under one roof, is really meaningful, that patients don't have to travel from one place to the next place to the next place to receive their care.
I think our new Chief Administrative Officer, Ned Groves, really got it right when he said the one word that best describes the Jack and Sheryl Morris Cancer Center is hope. What I hope is that this facility and the talented providers, staff, and investigators that work within it are going to deliver new hope to our patients with a cancer diagnosis.